Women are unique creatures with unique problems, and there comes a unique challenge in managing diabetes if you're a woman. Why is managing diabetes challenging in women? The unique challenges posed by the hormonal influences on the woman's body and the various stages in life of puberty, conception, postpartum, perimenopause and menopause that the woman's body undergoes. Before we delve further into this topic, click like and subscribe so you can get updates into your inbox directly. The first thing, we did mention earlier about the hormonal influences on a woman's body and the unique challenge in managing diabetes. So why is it that this is important for us to know? Female hormones and insulin sensitivity are related to each other. Unique changes in the hormone levels can be difficult or can cause difficulty in managing and controlling your blood sugars. If you had been following our videos, we did talk about the unique challenges in 20s and 30s that the woman faces and the importance of health checks. So this is where that health check becomes important. Apart from type 1 diabetes, young women in their 20 and 30 may not know what diabetes is, but a more familiar term called polycystic ovaries is something that every woman has heard of. So in a woman who has been diagnosed with polycystic ovarian syndrome, obviously the risk of future development of diabetes automatically increases. A diabetic woman has got higher risk of developing cardiovascular or heart disease as compared to a man with diabetes. There can be other challenges that come with the diagnosis of diabetes, like recurrent urinary tract infections or yeast infections or vulvovaginal infections. They're all short-term issues. In the long term, diabetes can affect any part of your body: brain, eyes, heart, kidneys, arms, legs, so peripheries. Any of that could be affected. Here's a small snippet for you. A woman with diabetes is 4 times the risk of developing a heart disease as opposed to a woman without diabetes. I'm sure you all know that there are different types of diabetes, but I'm just going to give you a small overview. Type 1 diabetes is wherein the diabetes is diagnosed at a very young age. So the pancreas is unable to produce the insulin, and that continues for the rest of a person's life. This requires constant monitoring of blood sugar and constant insulin administration. More commonly, type 2 diabetes is known to all, although there can be a hereditary or genetic factor contributing to this. Most importantly, environment contributes to this. What does environment mean? Your lifestyle choices. So if you're eating unhealthy, if you're not exercising, if you're overweight, or if your waist circumference is high, they are all risk factors for developing diabetes. Many pregnant women would have been struggling with this diagnosis called gestational diabetes mellitus. This is diabetes that is unique to pregnancy, and we expect that this would resolve at 6 weeks after childbirth. But about 50% of women progress on to have impaired glucose tolerance or impaired fasting glucose or develop full-blown diabetes. Another snippet for you. A woman who has got gestational diabetes, GDM, is 7 times more likely to develop diabetes in future. As mentioned in the beginning of this video, hormonal influences can influence the management of diabetes in a woman. So obviously, puberty, regular menstrual cycles, pregnancy, perimenopause and menopause can influence the management. What's unique to pregnancy is that you need to understand that placenta is a glucogenic organ, so which means it produces or it makes your body produce more glucose. So the pancreas has to work harder. Unfortunately, in some women, it is unable to meet the demands and you end up with gestational diabetes. Once the stress of pregnancy is over, after 6 weeks after childbirth, we expect the pancreas to cope normally, which is the time we expect your GDM to resolve. Many of you are seeking help from people like Diabetic Coach, but let me tell you, you can do this by yourself too. What are some of the simple steps that you can implement in your own life? You have to put in some effort, but if you do the effort and with consistent input, you can plan your meal ahead in time. So personalizing the meals with including whole grain foods, lots of vegetables, fruits and protein in your diet will help control your blood sugar. Bearing in mind, you will need to adjust this according to the age group that you're in, as well as the phase in the menstrual cycle that you're in, because you may be hit with some cravings. And if you have been following our videos, in almost 90% of the videos, I always emphasize on physical activity. So this is no different. Physical activity is very important, and being consistent with that physical activity, be it walking, running, jogging, or weightlifting, is really important for management of diabetes. Regular physical activity will lower your blood sugar and improve your insulin sensitivity. What if you have been diagnosed with diabetes and you're on medications for the management? What do? Monitoring is essential. So your healthcare professional would have discussed with you the importance of monitoring your blood sugars. In the beginning, it would be what we call 4-point BSL monitoring, fasting, 2 hours after breakfast, lunch, and dinner. Once you're stable in terms of management of your blood sugars, the monitoring frequency and timing will be advised by your own healthcare professional that suits you. I would like to emphasize something very simple but very important. If you are doing the finger prick test to monitor your blood sugar, please use the sides of your fingers rather than the pulp, which is very painful in the pulp, whereas on the sides it's less painful. Both are painful, but this one is less. If you're taking medications, it's important to be compliant with your medications. So taking it regularly as advised, either with food or after food, and determining if it needs to be taken once, twice, or thrice daily, and sticking to that becomes important. If you have been prescribed insulin because medications aren't enough for you, usually your diabetic educator would have taught you how to use your insulin, and it is important that you follow those instructions in terms of administration of the insulin, the quantity, and how you use your pen and the care for your insulin pen. That's a lot to take in. So obviously stress and anxiety may kick in. So managing your mental health becomes important. Again, I have emphasized this in all my videos regarding mental health. So probably taking a walk in the nature, mindfulness, breath work, yoga, anything that suits you, anything that suits your lifestyle. It is daunting, but with perseverance and good support systems and proper care, your diabetes is truly manageable and it can avoid and prevent complications. So I just want to share something with you here. A dear friend of mine who is currently in her 60s, she's head of department, and this is quite personal to me. So she's head of department, she's got a beautiful son and a daughter. She's been struggling with diabetes. She had a cardiovascular complication because of diabetes, but with good support from her family, from her healthcare professional, and education, so improving her physical activity, paying attention and concentration to her protein intake has helped bring her blood sugars under control. And now she is living a life with a well-controlled diabetes, keeping all her complications under control. So she did have retinopathy and cardiovascular complication, but they're both under control, and today she is ready to travel the world. I'd like to bust a couple of myths about diabetes. You must have heard, only obese women or women with high BMI can have diabetes. No, it can affect anybody. Yes, you can fall pregnant even if you are a diabetic, and you can avoid complications if diabetes is well managed. So as mentioned, diabetes can be unique in women because of the unique challenges we as women bring to it, but appropriate care will help manage it without further complications. So if you did like this video, share it with your friends or to the women in your life who are important to you.